So here you are going to watch Coblation adenoidectomy in a 4-year-old child with a grade 5 adenoid. The adenoids are actually coming inside the nasal cavity. I have pulled this off palate with a catheter, as you can see here, saline piece, and I'm trying to get my wand from the oral cavity into the nasal cavity. Just trying to reach there. There's no space for me to move the wand, but it's my duty to come out till my uh, insulated part touches the soft palate saline piece. Okay, thank you. And I'll just debulk some of the adenoids so that I can get space to move the wand. Right now I have no space to move my wand, but in a moment I'll create some space. And that's the superior boundary. As you can see, there's hardly any space for me to move my wand. So the dissection is obviously pretty slow. That's all right. Now that's the superior boundary completely defined. I'll go layer by layer, create some space for myself. Now you can see that there's a lot of space created. And now I can move the wand a little more freely than before. Now we'll keep debulking since we can move the wand freely. Now our dissection will be a little faster. And as I said, the child is only 4-year-old, so you can see that even if the size of the adenoid was quite large, the vascularity is not very high. So there is not much bleeding in spite of the grade 5 adenoids. Now you can see the superior boundary almost completely defined. I'll just remove whatever little is still pending. That's the periosteum below the sphenoid bone. This is the nasal septum, and we have completely removed the lymphoid tissues from the superior boundary here. Now we'll go for the lateral boundary. So the lateral boundary, you can see the eustachian tube here. That's the torus tuberous. That's the torus tuberous, and this is the lymphoid tissue on the torus tuberous called the tubal tonsil. So I'll remove all the tubal tonsil, but I'll remain say 5 millimeter away from the eustachian tube orifice. That is the lateral boundary in the anterior part. Once I clear the lateral boundary in the anterior part, I will gradually go for the lateral boundary in the posterior part, which is the fossa of Rosenmuller. Now I am going towards the fossa of Rosenmuller, and simultaneously I am debulking so that I can see the posterior boundary also. So let me debulk the lymphoid tissues of the adenoids so that I can see the posterior boundary, which is the buccopharyngeal fascia. Now we'll keep on removing tissues layer by layer. That is the periosteum below the sphenoid bone superiorly. Now that's the fossa of Rosenmuller laterally. We will remove all the tissues layer by layer from the fossa of Rosenmuller, and also simultaneously remove tissues from the posterior boundary. That's the buccopharyngeal fascia. You can very clearly see. That is the fossa of Rosenmuller being cleared. We have to be careful about the pulsation of the carotids, if at all the carotid is in an abnormal position. Apart from that, there is nothing major here. Now, the fossa of Rosenmuller is almost completely cleared. We go behind the torus. Now you can see that there is still a little lymphoid tissue on the torus tuberous. We'll remove all these tubal tonsils completely so that they do not regrow. Now we'll go behind the torus, remain medially. We'll direct our wand medially at this point because laterally you can open up some vessels, which we obviously do not want to do. Now we are debulking a lot of lymphoid tissue here. And you can imagine how much space will be created for the child to be able to breathe peacefully immediately after the surgery. So this is simple plain debulking. Whatever I am seeing on the right side, I am debulking. Now we'll go for the posterior boundary, which is buccopharyngeal fascia and the entire extent. Can you just clean it? So you can see the buccopharyngeal fascia very clearly. Now I need to define that buccopharyngeal fascia in the entire extent. So we will go layer by layer, remove all the lymphoid tissues, as you can see here. It's the area behind the torus. That's the inferior boundary where we are actually working now. Inferior boundary is the Passavant's ridge. You can see we have gone behind the torus, removed everything right till the buccopharyngeal fascia, right till the Passavant's ridge. Now if I need to clean my scope, You can simply touch on the tissues like I just did. Need not come out again and again. And the last bit of tissues till the buccopharyngeal fascia. You can see it's completely cleared on the left side. All the boundaries are clearly seen. There's just a little bit of tissue here behind the torus, just a little bit more of lymphoid tissue, which I am removing. Now you can see the boundaries of the adenoid surgery on the left side. That's the superior boundary, which is the periosteum below the sphenoid. Lateral anterior is the torus tuberous. Lateral posterior is the fossa frozenmuller. Behind is the buccopharyngeal fascia. Inferiorly is the Passivant's ridge. So left side is done. Now let me do whatever I can on the right side from here itself, because I can still see a lot of issues very clearly and I can debulk them. So I'll finish off as much as possible from the left side itself. And you might have realized that I have not taken out my scope even once. If you keep on going in and going out, then you damage the turbinate and the septal mucosa, and therefore we try not to move the scope in and out of the nose. So we'll do the same thing on the right side, but whatever I can finish from the left side itself, I'm trying to perform. You can see very, very clearly that all the lymphoid tissues have been removed, but we have not opened up the fascia anywhere. So this child should get a recurrence-free life. Obviously, allergy can still be there, but for that, a simple nasal spray should be good enough. He will not have enlarged adenoids. He will not have postnasal drip because of adenoids. He will not require another surgery in his lifetime for adenoids. We can only guarantee that much, that whatever we have done today will not give him a trouble again. Now you can see that the power of this wand is actually getting lower and lower. Still working, but it's not as nice as it was working earlier, so which is normal. So this wand will be actually worn out by the time we finish the surgery, or sometimes we may even have to open up another wand in the same surgery. Now that we have completely performed the adenoid removal on the left hand side, that's the buccopharyngeal fascia. So obviously we have not opened up the fascia. That's the level of the passivant's ridge. I'll remove completely, but I'll not open up the fascia. So near complete removal of all the lymphoid tissues on the left hand side. Fine. So now I'll come to the right side. Thank you.